The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Sierra Morgan and Samantha Kelly. Sierra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Hello, everyone. Today we have Allison Waage with us. She is president of Nurtured TX, Texas. She is a native Texan, mom of two, and passionate advocate for maternal and child health. Thank you so much for being here with us today.
Oh, thank you guys so much for having me and for inviting me to be on the podcast. I'm really excited to talk about Nurtured.
Yeah, we're really excited to have you here. We've used Nurtured as a resource for many years, kind of before you had your name change and everything. And so we're excited to hear what's happening now and kind of let our viewers know, our listeners know, viewers, if you're watching on YouTube, you're a viewer, let everybody know kind of what your mission is. So to start us off, tell us, what is your mission and what do you do to make perinatal health more accessible in Texas?
Yeah, thanks so much. So Nurture Texas's mission is to connect Central Texans to perinatal mental health resources before, during, and after pregnancy. We do that through a variety of services. We provide therapy and psychiatry vouchers through our Connect to Care program in Central Texas. We also have a free online provider directory called Christie's List. Christie's List was named after a wonderful woman named Christie Waage, who was a friend of many of the founders of PPHA, which is Pregnancy and Postpartum Helplines of Texas. That is our former name. We're now doing business as Nurtured Texas. But she was an amazing person, and she unfortunately lost her battle with postpartum depression. And a group of moms came together and said, what can we do about this? What resources can we provide so this doesn't happen to other women and families? So Christie's List is a way to help make perinatal mental health care more accessible to the community. So if you aren't sure, like, who do I go to if I need a therapist or a psychiatrist, you can log on to our Christie's List directory, and it's a searchable directory. So you can find someone who takes your insurance, someone who provides services in your preferred language. So it's a great free online resource. We did launch it statewide as of August. So previously, it was primarily folks in Central Texas, and we're now accepting applications across the state. I will say it's great for the community. It's also great for providers. So if you're a provider that has been trained in perinatal mental health care, you have experience with it, we encourage you to apply. We do waive dues for providers of color and also providers that are able to provide services in more than one language. So check it out. It's on our website, but that's our two main services. We also work to make care more accessible by offering a free support group. It's online. It's called Mamas for Mamas. And Mamas for Mamas, we accept folks from around the state of Texas who may need, maybe are experiencing more than just the baby blues and who need that support network. So that's another program that we provide. And then if you're a provider and you're looking for continuing education credits, we also have an online course education library, and funds that we raised from those courses go back into our programs.
Wow, that's awesome. You guys are doing a lot. I remember we were at an event here in Austin called Doula Share, and we were set up, and it was in a room that had a bunch of tables. And at the end, Sam and I were like, wait, I don't think we went and talked to that person. Who is that? What is nurtured? Like, what is that from here? And when we went over and we found out that it was PPHA, we were like, oh, we just had to make that flip in our mind. But I can see why you guys changed the name to Nurtured TX. It's a lot easier to remember and say. So can you share some of the biggest barriers that perinatal mental health care has to families in the Texas area or region?
Yeah, sure. Well, as many of you know, Texas is currently in the midst of a maternal mental health crisis. Maternal mental health conditions are a leading cause of pregnancy-related deaths in our state, and these deaths are preventable. I think the numbers are at 90% preventability. Barriers like a lack of access to care, societal stigma, socioeconomic disparities only make this challenge harder to overcome. And the ripple effects of these challenges don't stop with the mothers we serve. They impact the children, the families, and the communities as a whole, and they leave a lasting mark. So the need for really compassionate, accessible care is really growing, not only in Texas, but across the United States. We know that current data has also shown that Texas abortion restrictions have intensified this crisis for birthing people, and it's creating an even greater need for support in the years ahead. A lot of the times we have folks coming to us, citing the high cost of care. A lot of these providers may be self-pay, so it's really expensive. There may be limited access to providers that have expertise specifically in perinatal mental health conditions. Maybe they have no family leave available. So there's a lot of factors of just being a birthing person, postpartum person in America that leads to increased stress. And stress can increase your risk for maternal mental health conditions. COVID certainly also was a factor in increasing this risk factor in our population. So those are really where we're trying to meet that increased need. We're trying to be kind of a safety net for folks that maybe aren't able to afford or access appropriate care.
Yeah, there's so many pieces to it, especially here in Texas. We have a large amount of what they call maternity healthcare deserts, and that includes perinatal mental health in addition to just finding someone to deliver your baby. And so it's really exciting to hear that y'all are able to start expanding in all areas of Texas, because it does allow for more people to access care that they so desperately need. We've talked about it a few times on this podcast, but I feel like COVID added so much to the mental health struggle in the United States overall, but also it gave us so much more access to care, I think, because so many people are able to do like telehealth and that sort of stuff now that we really didn't have a whole lot of, or at least it wasn't as widely accepted before. So that piece at least is really nice, is even if there are no mental health care providers in your area, you can access some through telehealth.
Yeah, there's definitely a lot of virtual telehealth options that have come out of the COVID-19 pandemic. And certainly when we have folks use our Christie's List directory online, we're sure to say that a lot of our providers do provide telehealth services. So even if they may not be located in your city or your area, to let us, reach out to us, let us connect you with someone who's going to be able to help you in a timely manner. But yes, I certainly agree. I think there's, that is one kind of benefit that came out of the COVID-19 pandemic, is it kind of forced the hand a little bit in encouraging telehealth as well. I think one of the barriers is just outreach, right? Like as a small lean nonprofit, we have resources to help people, but it's getting the word out and making people aware that we provide those services, and also that we're available as a directory. Even if you're in rural Texas, we can work to get you through our network and get you connected.
Oh, that's so amazing. I love to hear it. So we talked a little bit about some of the programs and different things that Nurtured offers with Christie's List and with the Mamas to Mamas program. Did I say that right? Mamas to Mamas?
Oh.
Yes, Mamas to Mamas program and all those different things. As far as like the vouchers for accessing care, how do those work? Like, is that like a grant program, or can they just kind of choose any provider? What does that look like?
Yeah, that's a great question. So we have changed the way that we administer, well, that we market the program. So previously with PPHA, we had our therapy voucher program and we had our psychiatry voucher program. So therapy voucher program, previously, you would get up to 8 sessions with a highly qualified provider at a deep discount. I think our criteria is if you're making less than 250% of the federal poverty level. We now have increased the number of sessions based on feedback from clients and therapists that they felt like they needed a couple more sessions. So we have increased the number of sessions we provide to 10 sessions for our clients. We also then have a psychiatry voucher program. I will say that more clients tend to utilize our therapy voucher program than our psychiatry voucher program. And that's due to increased access to psychiatric care in Central Texas. The UT Mulva Clinic has a group of providers that provide care to this population. So we definitely use probably our therapy voucher program more. But the process for that is we have tried to simplify client outreach. So if clients struggling, there's one button on our website for them to say, help me connect to care. They click on that, they can fill out or contact us via email, and we'll kind of assess them. We'll do an intake assessment. Beth Thomas, she's a therapist and she is our director of programs. She provides our intake assessment services. So she'll talk with a client, usually 30 minutes to an hour, to get to know what's going on with them and what services they would benefit from. Even if a client doesn't necessarily qualify for our Connect to Care program, we still are going to work to give them a warm handoff to a provider. So we have our own network of providers. We have a way to communicate with that network and say, hey, we've got this client who has Blue Cross Blue Shield. They looked online and they can't get in for 3 months. Is anyone taking new clients? And we're able to kind of help get them connected and seen. So again, we've tried to simplify that process. Have us reach out to us. We'll get you directed in the right place. So yeah, we often have our referrals come from multiple different spaces. So we've had referrals from OB-GYN providers. We've had referrals from psychiatry providers where a client needs therapy services. And we've had referrals from pediatric providers. And then we have self-referrals of people finding out about us and reaching out. So there's a lot of ways that people find us. We know the people are out there. It's a matter of us. A big focus for us kind of this next coming year is outreach and getting our name out there and making folks aware of our services.
And this is a question that we didn't have on there, but I'm curious, compared to, I guess, the services that you're providing right now compared to your capacity, do you have a lot of capacity to provide services that you haven't been able to fill yet?
That's a good question. I will say that we've been in really as an organization as a whole in our capacity building stage, and that's really building the infrastructure to support more moms. Our ability to serve the community is based on the funding that we have. We do have the funding now to currently serve people, and ensuring we have adequate funding is always on our mind. And our funding sources come through a variety of different avenues. We did just hire our first very part-time executive director, but otherwise the funding that we have as an organization primarily goes to direct client services. So we get that through individual donors, through grants, also through revenue that we bring in through our education courses as well. But yes, it's definitely something that we're always thinking about, is how we continue to expand and meet the need, but ensure that we have that adequate funding to follow and continue to serve folks in Central Texas.
Yeah, that makes a lot of sense. I was just curious. We hear a lot about grant programs and how, it's kind of like a use it or lose it sort of situation. So I was curious where y'all were at with that. That's great to hear though. So what would you say is one piece of advice that you would want to give an expecting parent who is really struggling to access the care that they need?
Yeah, if you're a parent who's facing difficulties accessing care, just know that you're not alone. Reach out to us through our help. We usually get back to folks within like 6 to 12 hours. So we're really responsive. We've got a couple folks monitoring our inbox and intake. And of course, if someone is in a more emergent situation, then we can make sure that we direct them to the appropriate care if they do need more immediate emergency care. But yes, there's reach out to us if you're feeling overwhelmed. I think a lot of times we are trying to figure out how to simplify the way people reach out, because the process to finding a provider, making sure they take your insurance, getting on a schedule, getting baby fed, getting to an appointment. There's a lot of different things that you have to complete before you're able to get there. So how can we support the birthing person and help them get the care that they need? So my piece of advice is you're not alone. Reach out. We're here to help. We're here to connect you to the right place. And just reaching out to ask for help is the important first step.
Yeah, we have a lot of parents that if they are already showing signs of this could be something that they're needing, really anyone we recommend this to, but specifically that finding a therapist beforehand that takes your insurance, like kind of doing that legwork so that you have that name in place just in case. And then we do hear a lot of people that are like, I just feel like I've fallen through the gaps. Like I don't, and like you said, you don't have the bandwidth to do all of those things when you're already in the state where you need so much help. So having you guys as that resource of being that connector piece, even if you guys can't help, you might be able to find somebody that can. So that's a really great first step. So if you are listening to this episode and you want to help, how can listeners support Nurtured TX? Are there donations, or can they volunteer? Would it be help spreading awareness on socials? What would that look like?
Yeah, thanks for that question. Listeners can support us in a variety of ways. Visit our website. It's nurturedtx.org. We do have a donate button on our website. You can donate one time or as a recurring donor. We don't have like a formal volunteer program, but if you do have some expertise you feel like you could share with Nurture Texas, reach out to us. We've had folks do that before. So students reach out and say, hey, I want to get involved, and we're able to get them experience with like public health outreach, ways to kind of get connected in the community. So while we don't have a former volunteer program, if it's something you're interested, reach out. We also often have board opportunities. So if you're interested in board service, one big thing for me as board president is our board has varying levels of board expertise. You have a lot of folks that are really passionate, maybe don't have the board experience. It's a lot hard to get your foot in the door when it comes to board service. But I have found that people who are new and energized bring a lot to the table, and ensuring that we have kind of a breadth of expertise on our board is really important. Spreading awareness, we have our amazing executive director is like a social media guru. So just having her be able to like understand all of that and like share. One thing I haven't mentioned that I was going to say is one of our main priorities this next year is ensuring that our outreach includes Spanish language as well. We do provide Spanish language intake assessments. So if we have someone who's primarily Spanish speaking and reach out to us, we have someone who can do that intake, and we also have Spanish-speaking providers that we refer to. So doing more outreach to Spanish-speaking communities is certainly something. If you're connected or an influencer in that space, we'd love to get connected. But yeah, just continue to share, like our page is a great way. Right now, I know this podcast will come out a little bit later, but we're participating in Amplify Austin to raise funds this year. So that is something that's one of kind of our ways that we get donors is through Amplify Austin. But yeah, spreading awareness, sharing our education that we provide online is also great as well for folks to find us.
That's so awesome. I love all of this. So for people to go find information about Nurture Texas and the resources that y'all provide, where can they go to learn more about you?
Yeah, so nurturedtx.org, our website, but you can also follow us on social media. Our Instagram handle is @NurturedTexas. If you search Nurtured Texas on Facebook, you can also find us. And we also have a LinkedIn page. So that's a way you can we are very active. We post 3 to 5 times a week on our social media on a variety of topics, and a lot of education on perinatal mental health topics. We often have guest speakers that come and speak on topics as well.
That's awesome. That's huge.
Yeah.
Thank you so much for coming on, Allison. I think this was really amazing. I love what y'all are doing. I love the mission, and we're excited to share more about y'all.
Thank you so much. I really appreciate the opportunity and your support and for getting the word out there.
Thank you.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.